Now.
Pregnancy and Health by Knox. This is my contents. In this presentation we will be looking at gestational diabetes during pregnancy, preeclampsia and the misuse of substances while pregnant. I'll be looking at risks, symptoms and care plans and everything that can be done to make sure you have a healthy pregnancy. Section 1. The development, diagnosis and care of gestational diabetes. Gestational diabetes is a diabetes that occurs in pregnancy even when you haven't been diagnosed with a type of diabetes before. A person's blood sugar levels are normally controlled by the production of insulin. When your blood sugars are low, insulin is released into the body, and when high blood sugars are detected, glucose is converted into glycogen by the liver to manage the sugars. This is a very important bodily process because when the process doesn't work, the body can become either hypoglycemic, which is blood sugars too low, or hyperglycemic, blood sugars too high. Diabetes is diagnosed when the body doesn't secrete insulin to manage the glucose in the blood. Gestational diabetes is when your body does this during pregnancy. When you're pregnant, the body has to make extra hormones for fetal development. In doing this, some pregnant people get insulin resistant, which causes blood sugar levels to stay high. It is known as the contra-insulin effect. As more hormones are made after the second trimester, the insulin resistance also increases. Gestational diabetes also normally disappears after giving birth. It normally affects 4 or 5 in 100 pregnant people. It can be diagnosed at any stage of pregnancy, but normally shows from the second trimester. Even though it normally goes away after birth, it does mean that there is a higher risk of contracting gestational diabetes in other pregnancies and of getting type 2 diabetes later in life. The symptoms of hyperglycemia, this is when your blood sugars are higher than normal, are a dry mouth or very thirsty, increased urine output, dizziness or lack of balance, blurred vision, tiredness or fatigue. The symptoms of hypoglycemia is when the blood sugars are too low. You get very hungry, shaking, sweating, dizziness and blurred vision, and feel like your heart is having palpitations. The risk factors of getting gestational diabetes in pregnancy. There are a few risk factors to developing diabetes during pregnancy, and these include previously having a baby weighing over 4.5 kilos or 9.5 pounds, being over 40 years old, having a BMI of over 30, previously having gestational diabetes, having a close relative that has diabetes, like a parent or sibling, having PCOS or polycystic ovary syndrome, being from one of the ethnic minority groups of South Asian, Caribbean, African, Chinese or Middle Eastern. How gestational diabetes is diagnosed. During the first appointment with your midwife, the booking in appointment, before 12 weeks, you will be asked a lot of questions about your medical history. If even one or more of the risk factors are flagged up then the pregnant person will be offered a screening test. This is optional. It will also be offered because the pregnant woman has other symptoms, including headaches, extremely thirsty, having a dry mouth, increased urine output, being more tired or fatigued, dizziness, lack of balance or blurred vision. Some signs may also be found if the fetus is examined or monitored. For example, a larger than normal fetus is a risk factor, although it is not a definite. High levels of glucose can also produce more amniotic fluid around the fetus, which can lead to a premature labour. The screening test for gestational diabetes is called the Oral Glucose Tolerance Test, or OGTT. It is normally taken between 24 and 38 weeks. It is done in hospital or a clinic, diabetic or antenatal, and it takes around 2 hours. The pregnant person must fast before screening and takes for at least 8 hours. Some pregnant women will also be asked to stop certain medications until screening is completed. The screening starts with a blood test to measure glucose levels. The pregnant person will then be offered a glucose drink to consume and then wait 2 hours before another blood test will be taken. The fasting is also required after this drink. This is the end of the test. The results between the two blood tests will see how the glucose has affected the body. It was also possible for a woman to have no symptoms while having gestational diabetes. This can heed diagnosis. Possible care plans for someone with gestational diabetes. Whether a pregnant woman has diabetes during pregnancy or not, the pregnant person and fetus will be checked at every appointment with a midwife. However, if they have diabetes, they will also be checked every week or two to check how their blood sugar levels have been and whether they are being controlled properly. The pregnant woman will be given extra ultrasounds to check the fetus. As soon as gestational diabetes has been confirmed, information will be given straight away into what gestational diabetes is and how it can be managed. They will be given a blood glucose meter and instructed on how to use it. Advice will be given about diet and physical activity. They will be shown information on hypos and hypers, as well as information on all available medications. You will also have the chance to ask any questions. Your care plan is there to control your blood sugar levels as near to normal range as possible. It is always recommended that someone with gestational diabetes monitors their blood sugar levels regularly with a glucose monitor. The device takes a small amount of blood from your finger, which is then put onto a test strip. The monitor can test the blood by evaluating the glucose, then displaying it on the screen. Some professionals require you to monitor at certain times, including before meals, random times in the day, alternating days at meal times, and when you first get up in the morning. You may also be referred to a dietitian to help manage your diet. This will help to make people understand the effect different foods have on your glucose levels. The pregnant person will be asked to watch out for foods with high glucose index or GI foods. The higher the GI, the more it will affect the glucose in the blood. Foods come in medium, high or low GI. People with gestational diabetes will be recommended not to eat for 2 hours after eating and not to eat an hour before a meal. They will ask you to refrain from eating as many high GI foods like sweets and jams, as these spike your sugars. You will be told to eat the same size meals spread out throughout the day. Having regular physical activity, as this reduces glucose levels. The NHS reports that 150 minutes of moderate activity a week is recommended. The pregnant person may also be offered medications depending on how they manage their sugar levels with diet and exercise. The medications are normally metformin. This is a tablet that doesn't contain insulin and it reduces the amount of glucose produced by the liver. Insulin injection. These are injected into the person's stomach as insulin would be digested if it was taken orally. The dose may change as the pregnancy progresses. Section 2. The development, diagnosis and monitoring of preeclampsia. Preeclampsia. This is a serious condition that can affect around 1 to 5 in 100 pregnant people. It is normally diagnosed in the second half of pregnancy, but it can happen at any time in pregnancy. And it can even affect some people after they have given birth. It can affect the pregnant person and the fetus, making it important that it's picked up as early as possible. 1 in 200 that have preeclampsia have serious complications. It can affect the liver, brain, kidneys and the bloodstream, including blood clots. It can also cause fits called eclamptic fits. There are 3 types of preeclampsia. Mild, this is when the blood pressure is more than 140/90 and there is protein found in the person's urine, also called proteinuria. This type involves monitoring and seeing if it settles or gets worse. Severe, this is when the blood pressure is much higher than normal, normally 160/110 and higher, and protein is found in the urine. The pregnant person is more likely to be kept in hospital for extra monitoring. It may also involve treatment to make sure that eclampsia doesn't occur. Chronic hypertension with superimposed preeclampsia. This type can occur when the pregnant person has already been found to have a chronic form of hypertension or elevated blood pressure. Factors that put a person at risk of developing preeclampsia. There are a few factors that could put you at risk of preeclampsia in pregnancy. These include age, being over 40, having twins or multiple births, having a BMI of 35 and over, having diabetes, kidney disease, or having a high blood pressure before pregnancy, having an autoimmune disease such as lupus, previous preeclampsia in close family pregnancies, for example your mother, a previous premature birth, having a pregnancy 10 years or more after a previous one. If you are found to have 2 or more indicators of developing preeclampsia, your midwife or healthcare professional will recommend some changes to reduce the risk. These include adjusting your diet with aims of lowering your BP, looking at your BMI and supporting your weight loss, stopping smoking. They will help with stopping substance abuse, including alcohol, and they may start you on a low dose of aspirin. Symptoms of preeclampsia. Preeclampsia is not always easy to spot, and there are many different symptoms that display that are different from one person to the next. Here are a few of the most common symptoms. High blood pressure levels of high blood pressure, protein in the urine, swelling of the hands, feet and face, blurry vision, bad or severe headaches, feeling unwell on a regular basis or consistency, pain below the ribs, normally in the upper right area. On some rare occasions, the pregnant person may have no signs or symptoms. This means that there is a greater chance of it not being detected. Because of this, every time you see your midwife while you're pregnant, you will have your blood pressure taken. This is also so they can monitor it for significant changes. Some pregnant people also feel more at ease if they can check at home. This is a good way to see if any changes. The diagnosis of preeclampsia. There are multiple tests that can be done, through many tests and examinations. If a midwife finds you have high blood pressure during antenatal visits, then you will be sent for screening. You will also have your urine checked regular. This is to check for any proteins. If detected on a test strip, another sample will be taken and sent to the labs. Preeclampsia is normally diagnosed with high blood pressure and protein in the urine. Other factors include higher levels of creatine, pain or dysfunction of the liver, and abnormal ultrasounds of the fetus, it being small enough for the gestational age. After 20 weeks of pregnancy, if you have high blood pressure, you may be sent for blood tests to examine your protein levels. It will look at the levels of placental growth factor, or PIGF, and if they are high, the possibility of preeclampsia is high. If a pregnant person has been diagnosed with severe preeclampsia, then they will be advised to stay in hospital for monitoring and treatment. If the fetus shows that it is small enough for its gestational age, it could also be a sign of preeclampsia. This is because it has been shown that people who develop preeclampsia have smaller placentas. This means that smaller amounts of oxygen and nutrients are making it to the fetus. If this is shown, then more monitoring will be given, including more scans, which can monitor the fetal blood flow and amniotic fluid. Monitoring and caring for a person with preeclampsia. Normally, as soon as any type of preeclampsia is diagnosed, they will be admitted to hospital. If their BP says less than 150/109, they'll be watched and monitored while at home. This may involve outpatient appointments regularly to check blood pressure and urine samples and see if the person can regulate their blood pressure without intervention. A midwife may suggest that you change in diet, for example low salt or low fat dairy, and making sure that you consume enough water. Depending on your test results, the person may be given medications. Some may be labetalol or nifedipine. These aim to reduce blood pressures. Other medications may be given, but that will depend on other medications that are taken and any allergies, the person's preference, and if any side effects are had. It is recommended that it is continued even after birth. It also depends on the severity and point in pregnancy as to what the hospital can do for preeclampsia. Before 34 weeks, monitoring both pregnant woman and fetus, and there will be discussions on having a possible early birth. They may be given medications to lower blood pressure. Between 34 and 36 weeks, the same as above. However, because the due date is closer, they will look at risk factors to both mum and baby, whether they may need to move to better medical facilities, for example, better NCIUs, and whether they will induce early. An early birth may be because of uncontrolled blood pressure, even with medications. The symptoms become worse, or there is damage being done to the kidneys or liver. After 37 weeks, inducing labour may take place within 48 hours of being diagnosed. Other checks may be done are the fundal height measurement, ultrasounds, monitoring fetal heartbeat, and possible amniotic fluid testing. After birth, the person's blood pressure should return to normal. However, they will be monitored for a few days in hospitals after birth. The woman will also be monitored for 6 to 8 weeks after birth for signs of postpartum preeclampsia. This is rare but also involves high blood pressure and extra proteins. It is also treated with medications to lower blood pressure and magnesium sulfate. The potential issues that may occur if not managed are many serious complications for mum and baby, including lack of blood and oxygen to the fetus. The fetus may have restricted growth and be limited in what nutrition it receives. Possible damage to kidneys and liver for the mother, cardiovascular disease, or just stroke in the mother. The woman could have afterbirth bleeding, and the woman may get hemoglobin, elevated liver enzyme, and low platelet count. It is very rare cases that preeclampsia can turn into eclampsia. This involves seizures where the blood pressure is really high and constricted blood vessels in the woman's body, and this causes seizures. Eclampsia is more common after 20 weeks of pregnancy, and some warning signs of an eclamptic episode involve severe headaches, difficulty breathing, swollen hands and feet, being sick. Section 3. The dangers of substance abuse in pregnancy. Health risks for pregnant persons and fetus when consuming alcohol. Healthcare professionals will recommend reducing or stopping alcohol consumption during pregnancy to protect the fetus from developing problems or health implications during or after birth. Drinking alcohol means that it is absorbed into the pregnant woman's blood and in turn travels to the placenta and onto the fetus, where the liver has not developed to a level enough capable of processing alcohol. Alcohol in pregnancy increases the risk of preterm labour, fetal alcohol spectrum disorder, smaller baby for gestational age, or low birth weights. Damage to fetal organs or respiratory system, miscarriage or stillbirth, and susceptibility to illness from birth and in early childhood. Fetal alcohol spectrum disorder, or FASD. This is a disorder that affects the neurological development of a fetus and is caused by consuming alcohol in pregnancy. The fetus cannot process toxins from alcohol. Instead, it flows through the bloodstream and causes complications. Because it affects brain development, issues for someone with FASD could range from emotional, behavioural, neurological, or cognitive. Some FASD effects are learning or cognitive difficulties, delayed speech and communication issues, development or function issues with joints, muscles, and respiratory organs. Consuming alcohol while pregnant can also make your fetus smaller than it should be, also called SGA, or smaller than gestational age. This carries a risk of miscarriage, preterm labour, and even stillbirth. Low birth weight is also a concern when alcohol is taken in pregnancy. Low birth weight can come with other complications like hypoglycemia, breathing problems, and lower body temperature. The health risks for a pregnant person and fetus when illegal substances are taken. There is no illegal or recreational drug that will not influence a fetus or pregnant person in a bad way. Illegal substances include heroin, cannabis, opiates, and ecstasy. The safest way to protect the woman and fetus is to stop taking as soon as possible, and any alcohol or drugs, because they all go to the bloodstream. This can cause serious harm to the fetus and the person. The main effects are miscarriage, stillbirth, premature labour, and low birth weights. Different substances cause different problems, and I have I've laid them out for you. When the umbilical cord is cut, some babies can experience neonatal abstinence syndrome, or NAS. They will be taken to ICU for support and monitoring, and sometimes medication will be given to help them wean off. Thank you for watching my presentation, and we have looked over gestational diabetes, preeclampsia and pregnancy, including symptoms, screening and care offered. We have also looked at the effects of alcohol and substance abuse in pregnancy and the risks to the person and fetus. Please stay safe during your pregnancy.